That was terrific and very exciting. And so we've got about 25 minutes for discussion and questions of our great panel. And maybe I'll begin with a question about whether this is buzz or whether this is really going to happen. Is there a tipping point? I mean, we've got pioneers up here, but this social impact bonds I had never heard of before I came to this meeting. I'm being perfectly honest. So I guess my question for the pioneers here is how quickly we can hit a tipping point. Is there enthusiasm within the investment community and all the different intermediaries that need to come together to make this work? Where are we? You know, I think of the analogy in healthcare where we talked about pay for performance. What was it, George, 15 years ago when that concept first came? And we're not anywhere close to a tipping point in terms of, as you know, Rick, having total dollars that is really matched to paying for value and performance in healthcare. So it takes quite a while. Where are we here in terms of paying for results in population health? Rick, you want to start?
I would say we're early in the application of pay for success and impact investing in health. I think there are lots of complexities. You know, where does the benefit aggregate? Does it aggregate with one payer? Does it aggregate with 15 payers in a community? How do you work through those intricacies? How do you attribute the the intervention to the outcome? And how do you capture and access those sources of repayment? And I think that's really challenging on the government side, maybe not as challenging on the private side. So that's why we think self-insured employers might be an opportunity. But anyway, we're early despite the buzz. I told you earlier I have a Google Alerts for social impact bonds. I get 5 a day new articles on social impact bonds. That wasn't true 2 years ago. So.
Rob, your thoughts on whether this is going to catch on? I mean,
I think it
happened in Utah, and now you're in Virginia.
I think it absolutely is. I don't have any doubt about it. And the reasons are that, as Rick has pointed out, the data is now accessible, increasingly accessible. The knowledge of the upside-down pyramid. These are the contributors to health, and here's what we actually spend on, is becoming increasingly understood. The Affordable Care Act is making many things clear that weren't clear before. So I think that we are, in health, it's absolutely going to happen. And tipping point, I think yes, it's already happening. When you have managed care companies pursuing Medicaid managed care projects, taking capitation payments and then using interventions and reducing their own expenses and taking 100% of the profit, that's pay for success. Now over time, obviously, Medicaid has to adjust down what it's paying because the actual cost interventions have reduced overall cost, but the lagged adjustment is enough for people to make a good living for a long time. So my feeling is that it's absolutely going to happen. Whether it can happen in other areas besides, say, health, where the result and the intervention are so clear. When you clean up the house, you have lower asthma costs. It's not clear that that result was a result of something else that happened before. Where you have clear relationship between intervention and result, where you have clear data. The infrastructure, contractual infrastructure, is at its infancy. And here I like to tell people that people, especially people like me, I'm 69, but I can remember buying a house and the settlement agreement was about that much. And the reason why I had this like this, the legal architecture that exists around mortgage finance took decades to assemble. the legal architecture to enable pay for success to come about is going to take at least a decade to assemble. We have a couple of examples. Megan participated in a working group the middle of last summer in which we outlined the three top lawyers, and so we outlined the three main contracts that are needed in a social, in a pay for success, actually any pay for success contract, though we focus specifically on early childhood. Those contracts are there, all the terms are defined and so forth. That's just the first step. It's just an outline. So we need uniform contracts, we need case law, we need all kinds of things. And so, but all of that is going to happen. And the reason it's all going to happen is because it's so much cheaper to prevent a health problem than it is to pay for it afterwards. I mean, when you have CVS saying it's not going to sell cigarettes, you know something important has happened.
Megan, your thoughts?
Yeah, there's a huge pipeline. A lot of states and even counties have issued requests for information or requests for proposals to procure these pay for success contracts. So I think there's a wave that's coming. Whether it will stick, I think, depends on how narrowly we think about it. Because right now, for the first several deals, people are really focusing on programs that have a rock solid evidence base that yields savings in very identifiable system over a limited number of years. And if we keep too narrowly focused on that and we miss the opportunities to do like the work that Rick is doing, maybe on an earlier phase to demonstrate outcomes or to look at multiple outcomes or to look at situations that don't 100% shift the risk, then we're going to have too much riding on the first few deals. And if one or two of them don't work out, then it's all over.
Well, let's start to go around the room.
Andy, can I start?
Yes. David.
So,
Sorry, son, but he's the co-chair.
I don't
mean,
jump-
like, yeah.
I don't do it very often, but so first, thanks again. I mean, this is really great stuff, and you're helping us stretch our minds about this. So I'm impressed with building on actually all these comments. I'm impressed with the need for the evidence case of these interventions, and I'm kind of struck with, I get the feeling, of course, that you're early now, but just like what you said, Megan, I mean, you're sort of focusing on these few things that we have evidence about, that are both, it's clear from what, why the nurse-family partnerships is one, or, I mean, early childhood stuff has a long history, but there's a few of those. But once you get beyond that, it gets really tough and sticky. And I don't believe that we've invested, so this is going to be almost an academic comment, but it's practical. I mean, I've been frustrated. I mean, the Victor Fuchs quote, I mean, frustrated about how slow it's come along in the science of understanding, building a case that you say investors are going to need. And it's partly because it's hard work, establishing these causal relationships in social science. But also, I'm not impressed that our public research agencies the priorities haven't been there. And sometimes, I'm looking at Bob, sometimes in the government, you're not allowed to do cost effectiveness or whatever. So I guess my question is, I think the growth will be limited by going to the next layer of these things that have more complicated relationships. And I guess my question is, can we imagine some public-private research vehicles, that will maybe with government or without, that can begin to actually, and I used to think of it as just, I'm intellectually curious about these relationships, or maybe public policymakers will do the right things if the science is clear. But in this case, if the investors have to have that information to sort of make some money on it, is there a way that they can be a part of developing the evidence base for this next generation of things that'll move it along? Long question, but
The answer is yes.
Go ahead, Rick.
Yes.
that's great. Thank you.
And not to avoid the complexities of actually doing that. when I was at Cigna, three of us flew from Cigna on the East Coast out to UC Berkeley on the West Coast to meet with Len Sine, social epidemiologist, and his team. And we brought our actuaries, and we said, we just need you to complete this actuarial table on what really matters to health. And, after a day of trying to work this out, we realized, well, we can't do it. We can't really create an actuarial table on whether social relationships and improvements in food systems and so forth are going to translate, in the terms that an insurance company looks at. However, I think there are opportunities to develop a portfolio of investable, community-based interventions, and we need to do that, and it's actually critical to the work that we want to do with Hiccup. So, yeah.
Yeah, I think I agree completely. I think the answer is very definitely yes. There are a number of areas within the federal government in which money is available for research, and particularly it seems to me that we can put together packages of investors and local philanthropists and the federal and state funding for the feasibility study for a specific area like Danville, Virginia, or Cleveland, Ohio, or something like that. I think that can be done. And I'm very interested in Hiccup because Hiccup is a kind of way of bringing together the capital stack in health in a very organized way. I think that we're going to see a proliferation of these things. I can see many organizations coming into existence to solve these different parts of the problem. It's a wonderful thing about the U.S. culture, this nonprofit enterprise culture that we have, that I think we'll see perhaps hundreds of them.
Let me just quickly have a follow-up. I mean, because we're moving towards the end of the day now, pretty soon we're going to start reflecting on what this means for our roundtable and what we can do about it. And we have things we can do and we have things we can't do in this vehicle. But one of our 6 drivers that you saw is this box called evidence or science-based interventions. So we've identified it as important. It's kind of an empty cell right now, frankly. And that's something that we need to flesh out with our own work. And in the back of my mind, I've kind of thought maybe that's the research agenda box or whatever. But I mean, maybe there's ways that we can interact with you folks to sort of populate that in a more robust way than at least I've thought about it so far. So thank you.
One thing to think about is that there is great interest in the federal government, in the White House and OMB and Treasury in this financing mechanism. And there's been instruction to all the federal agencies to try to take advantage of it. And it's been taken up to various degrees by different agencies, with, I'd say, the Department of Labor going the farthest. But there's a group of people that are placed pretty well in those agencies, or in the White House, OMB, Treasury, that are just looking for ways to kind of get this financing mechanism advanced and implemented in the federal government. So maybe that could play a role.
Sonny, and then Martha, because Martha, I know you've been trying to get into the queue all day. So you're next after Sonny.
So Sandy Magnan from ICSI. So as I listen to you talk and I see your kind of circles of how you go about this, it makes me think of what we do in healthcare with Plan, Do, Study, Act. We just never had saving money as part of our cycle of Plan, Do, Study, Act. It was always health outcomes. I can remember I worked at a health plan for part of my career, and when I first got to the health plan, we'd be talking about risk, and all of a sudden I realized I'm thinking health risk, and they're thinking financial risk. And we actually need to be thinking both. And that's what I see you bringing together as these two things. But my question was, what gets your juices going? I mean, is it the saving money? I mean, is that what the Goldman Sachs, we've got to be more thoughtful and more academic and more research to show what are the things that save money? And yeah, we want to do good because it's social investing, but we've got to be more attuned to the saving money and more research about that part. We've got to have articles in the New England Journal and JAMA that maybe say all this good stuff that's done, But how many of those articles ever say, and here's the cost savings? Very few of them right now do that. But so talk more about what gets you guys going.
So yeah, Rob, I asked you what motivated you to get into this arena, and you gave me
an interesting answer.
Yeah, very interesting answer.
Yeah, I was a partner in a hedge fund. It's one of the world's largest and thankfully one of the most successful. And my job required me to be on a plane in other countries at least 2 weeks every month. So there isn't a finance ministry or a central bank or a legislature really anywhere in the world of a major country that I haven't been and talked with, and so I have friends all over the world. But I could see an awful lot of the world, particularly East Asia, the investment in human capital was at far, far higher level and more focused. Northern Europe, far higher level, more focused than ours. When you looked at the demographics of the United States, it's very clear that we actually are on track to not have enough life-ready 18-year-olds. That the economic value, the future present value discounted per capita GDP of a life-ready 18-year-old is going up, 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 which means you don't have enough of them. And we don't have any people to spare, actually. So I got involved with Jim Heckman, Nobel Prize winner, and Arthur Rolnix, head of research at the Minneapolis Federal Reserve Bank. We set up the Investing Kids Working Group in 2003, and that was to answer a question, which was, we saw debt increasing at 8% and GDP increasing at 3%. We know that chart can't continue. It's going to tip over. So we were looking for what could the country invest in to reestablish organic growth. We called it organic growth because we're not talking about current account deficits and all that. We're talking about, can the society grow itself? And we looked at infrastructure investment, we looked at information technology, healthcare, defense, all of that, came to the conclusion, basically, human capital is essential for every one of those to be successful in any of them. So we focused on human capital, and within human capital, we focused on conception to age 5, because that's when 700 neurons a second are being formed. That's when when you're going to put that human capital unit on its life arc. If it's going to land where you want it to at age 18, life ready, whatever it's going to do, that's the most important period. So we focused on that. That's how I got into it, basically looking at what other countries had already learned, but because we're so consumption and present focused, we had not learned it, maybe still haven't, but I think this work gets us there.
We've only got 10 more minutes. Martha, you're up.
All 10 minutes.
No. I don't need this answered right away, but I sort of am curious about what an adequate rate of return is when you sort of approach these things. But one of the things that I guess I'm worried about, and sort of following up from something that Dave said, is we don't have such a large evidence base. And I think Rob sort of was very clear about not only do we need an RCT to exist in order to move forward, but the RCT needs to have happened at the place where the thing is going to happen. And so to me, that's needing to be awfully secure. And
let me say a word. Before you get to the rest of your question, let me say something about that. Businesses throw billions of dollars in investments without RTCs all the time.
Right.
And what's going to happen is that as people come to understand this stuff, the value of this sort of old-fashioned pure RTC will become less necessary.
Well, that would certainly be encouraging to hear, because the point I want to make is that if you're already in a community that has the wherewithal to produce the thing that you want to do more of, then you're not going to the places. And so and the question really is, should we feel hopeful that these kinds of things are going to take off in communities that have less resources? And I want, that's a question to the whole panel.
Ladies first.
I do want to point out that of the 4 that have been announced in the United States, 2 of them have not had an RCT, are not in that way evidence-based programs, and the third is based on studies in other jurisdictions with slightly different contexts. And the one that was most recently announced just last week, I believe, was a Massachusetts deal involving an intervention called ROCA, which works with older teenagers and young adults who have been involved in the justice system. And they didn't have any serious evaluation research, but what they had was some very strong performance data that was enough to convince the government to pay for the outcomes. Actually, that was one of the recipients of Department of Labor funds, so the federal government is paying for a lot of the outcomes. And more importantly, the investors were convinced to invest. So I think it really, in the end, is going to depend on what the investors will be satisfied by.
Robert?
So I had two related comments, and one of them is actually a comment I made the last time I came to the committee, but I'm going to repeat it. So, one of the things I struggle with being from the NIH is different standards of evidence. And so what happens is that what you call evidence, or what our community calls evidence, might not be as accepted as evidence by others. So for example, my boss, Dr. Collins, had a piece in Nature last week that really goes after the replicability of basic science, preclinical studies. And it shows that actually, about 2/3 of preclinical studies that are done by pharmaceutical companies can't be replicated. That there's one title of a study in tumor markers tells the whole interesting story. It said all tumor markers predict cancer outcomes. Because the studies really had multiple outcomes or all these problems with them. Or if we look at randomized clinical trials, big phase 3 trials that are done by the National Heart, Lung, and Blood Institute, over the last about 15 years, it's just dropped off a cliff where most of these trials are null. And it isn't because that there aren't new treatments, it's because the standards for reporting trials dramatically changed. So they have to be pre-registered in clinicaltrials.gov. They have to specify a single outcome variable. So when we got much more rigorous about doing the studies and reporting them, actually the probability of finding significant things dramatically declined in both sort of basic and clinical science. So what I'm faced with is when I argue for these things, people say, oh, well, our science has rigorous standards and your science doesn't. And you need to help us with that. And apparently you've been able to persuade investors that this isn't a problem, but it is something that I deal with all the time.
Well, in the capital stack, there's a group of people who are very used to investing without any evidence at all. The philanthropic community has an idea, it has an aspiration, it has some effects and results that it sees, and then it invests $50 million in a symphony orchestra, because they believe this has certain cultural values and that sort of thing. In this instance, in all the instances that we've talked about, and Megan has been very clear about this, and Rick has talked about a thing called the capital stack, where there's Goldman Sachs at the top, which has to be repaid, and it's got line of sight to the money. And underneath of it is somebody like J.B. Pritzker or others, including, you with your time and effort, and me and others, that are saying, we're going to do this because we think it's the right thing to do. And unlike other philanthropic investments, this is one we actually get some fairly clear documentation of whether we've succeeded or not, compared to the other kinds of philanthropic investments that we've made in the past. So at the bottom of the capital stack, the people who lose money first are the philanthropic contributors. And so that means that we don't have the same problem that NIH has or the FDA. We don't have an asymmetric, so to speak, decision rule. The people who put up the money lose the money if it doesn't work. First the philanthropists lose, and then the commercial lenders lose. Is the data analysis and the experimentation and the evidence and factual context in which the transaction is based, is it sound enough to motivate people forward with it? If it is, it is. If it's not, it's not.
Let me just push back on that a little bit, because I think you started by saying, look, you formed an alliance with Jim Heckman. Why has he been so successful? Well, because, first of all, he's got a Nobel Prize, but in addition to that, he's done a very persuasive job of showing that that intervention within the earliest phases of life affects the way the brain develops. And he's connected himself with neuroscientists and all kinds of other disciplines and has built this remarkably persuasive case. And so when you say, well, investors don't care that much about evidence, in fact, it sounds like what you've done is you actually have
Oh,
packaged evidence.
absolutely. Oh, no question about it. We went, if they needed 70%, we gave them 85. Yeah, if they needed something about brain, we gave them 700 synapses a second. Absolutely.
Terry has walked to the front of the room, but I'm going to use my executive authority here and give Jim the last comment.
It's Jim Nickman from the New York State Health Foundation. I just had a simple question. The idea that entrepreneurs and businesses don't need or act so much without evidence, which I agree, but they have the self-correcting mechanism that if they're wrong, the market tells them and they lose money. We don't have that in the public sector or the health sector always, and I think that's why I assume that's why we're held to greater standards of evidence because, so anyway, so I'm not sure that really holds up because, if we had that profit motive, it would work, but I don't think it does.
Now, Debbie has a question.
Quick question, a follow-up, quick. A follow-up to Martha and David. On the issue of, I was really relieved to hear you say, Rob, that it's, that folks will invest without that strict randomized control study, because that will hold us back. Are they ready to invest now? What's the timing of that? Because, I mean, we're really interested in spread and scale and see this as just an exciting opportunity to spread and scale. And so, and especially the work you're doing in the community, that's going to be another test, right? Because each community is different and how you apply the intervention is going to really vary. It's going to be a good part of the portfolio. In terms of timing, are they ready now to work with us in terms of developing some type of open source
The open source, there's no open source on contracts. So there's a huge wall between Nemours and a project.
Yeah.
And that's just what does the law say? What does the legal agreement say?
Okay.
There will
That's one
be,
barrier.
over time, stability and off-the-shelf contracts that'll enable you to put together a pay-for-success project. The insurers, I think, from what I'm very encouraged by what Rick talked about.
Yeah.
What this means is I just can't actually wait to get on the phone with him tomorrow afternoon to hear more about forward motion on that and how do we access all that data. So Moore's law is telling us we're going to be able to process it more, twice as much data every 18 months or whatever it is. I just can't sit still. I just regret that I'm 69, that I don't have a whole other lifetime to devote to this. But it seems to me that foundations like yours need to sort of study the terrain in a similar way that Megan has done, which is kind of look at each of these projects and see what's there and what's not. Because at some point there's going to begin to be a proliferation. There's 17 states that are working on projects. In Virginia alone, there's probably 4 or 5 areas. So within each state, there's probably 4 or 5 areas. So we're moving towards the point where we're going to see a whole lot of ideas. And as you know, how many out of 100 ideas, how many are good ones? 20? Right, and that's what you're going to have to finance.
So great presentations, great discussion, new frontier. Again, thank Megan, Rob, and Rick.
Yes, good job. Thank you.
And over to our MC.
Yeah.